Dr. Altmann, again, thanks for your service to CMC. Thanks for being here, and I'll turn it over to you.
Thank you, Evan. Hello, everybody. I'm getting so many messages in the chat now. Hi, this is so exciting, as I know some of you. So I really want this to be a conversation today. I didn't prepare a formal talk or PowerPoint or anything like that, especially because things have been changing so rapidly. I'm a pediatrician in Calabasas, and one of my areas of interest over the last year has been or become COVID-19. Specifically, I've been working with K through 12 schools across the country and the American Academy of Pediatrics and a lot of the COVID safe guidelines. Now, hold on, I'm just trying to get here on the view so I can see all of you. Oh, this is great. Okay, so I'm sure that all of you have been, watching the news and following what's been going on in our country. And we have some really great news here. Things are definitely improving in the United States right now. And the main reason for that is our increasing vaccination rates. And that's really that's really been huge for us. And that's why today, I know that we had the lowest daily COVID case count since we did last June, and our hospitalizations and deaths now are the same as they were last March. So we're actually seeing numbers now that we did at the very beginning of the pandemic, and they are only decreasing, which is really amazing. I'm sure we have a lot of questions, about vaccines as well, which we can definitely talk about. But some of the things that I've been working on recently was the age 12 and up. We were so excited to get that FDA authorization, the emergency use authorization expanded, have the ACIP and the CDC and the American Academy of Pediatrics vote that it's okay to give and it's safe and effective. And so I've actually been working on vaccine clinics for the last 2 weeks throughout Southern California for kids of this age group. And I myself have vaccinated about 1,000 kids, which is more shots than I've given in my entire career as a pediatrician, especially because usually the nurses give the vaccines. But when you're running vaccine clinics and they need help, you just jump in and do it. And so it's been great. I was looking at the vaccine stats right before I got on from the CDC website. And in our country right now, in the over 65 age group, we have a fully vaccinated rate of 75%, which is huge. Over 18 years old is 50%, and over 12 is 45%. It's really interesting because the 12 to 15-year-olds are actually more excited to get the vaccine than those 15 to 18-year-olds. And I think it's because, they really know and understand what they've missed out on. They want things to get back to normal, and they're not scared. Even those that were afraid of needles are coming into the vaccine clinics and rolling up their sleeve and taking the shot. And we're seeing very few side effects in this age group, just a little sore arm. The kids are actually tolerating it a lot better than the adults who, as many of you know, often are having a little more of an immune system response and feeling kind of wiped out for a day or two. Because we are moving in such a good direction, I really anticipate that barring any, random, more severe mutation that our vaccines really can't handle, I think we're going to continue to move in the right direction. And I do expect that all schools, elementary, high school, colleges, should be fully open in the fall and running as normal as possible. Now, that doesn't necessarily mean that there won't be masks, and that doesn't necessarily mean that there won't be testing, but I think there won't be distancing requirements. There won't be, any of these hybrid things. You will be able to be fully in person, which I know is so important and needed. A few of the other things, and I want you guys to post questions and give me things that you want me to talk about. So maybe you can just type them into the chat sort of, as we're going. I've done a lot of news segments over the last 2 weeks. So some of the things that I've been getting asked, some people were a little disappointed with the news of the Yankees. I don't know if you guys heard about that. But to me, that actually shows just how amazing the vaccines are working. I think it was a really great real world example because 50 to 60 of them were all traveling together. and they were all vaccinated, and one person caught COVID, which we know that some people after vaccines are going to get COVID. It's very low risk. We also know that you're not going to end up in the hospital. You're not going to end up, seriously ill. But he was symptomatic. So he did spread it to another handful of the Yankees players who had no symptoms and did not get sick. And the only reason we knew that they were infected is because they tested positive. So the COVID-19 vaccine, it doesn't put a force field around you and say, hey, COVID-19 can't come near me. What it does is when you breathe it in, those antibodies that you have, they stop the replication and they neutralize the COVID-19 antibodies so you don't get sick. So that's what the vaccine does. It makes it so you don't get sick, and you also can't pass it on to others. So even those 5 or 6 people that tested positive, they didn't have symptoms, they didn't pass it on to others. And so it really shows that the vaccine is working well. And if we tested everybody in this entire country every other day, like they do with the professional sports teams, we would have a lot more of that data, but we don't. But I think it showed that, things are working really well. And Evan just asked if we are vaccinated, can we give it to someone else? So that's a great question. So the majority of people that get the COVID-19 vaccine of any age are protected. We know that it's 95% effective. So even the few times that it slips through, maybe it was a variant, maybe you didn't mount a full immune response, which we are seeing, with some people that maybe are immunocompromised or, were on medications for cancer treatment in the last year. In the majority of cases, if you do get it, you will have very mild illness and you're less likely to be able to pass it on to others. So we do think the rate of being able to catch it and pass it on to others is extremely low. So low that it's not really something that we worry that much about, unless you are somebody who is extremely high risk. And your doctor says, listen, like you just really, really, really need to be extra careful. So reaction to the shots and immunity, Allison's asking. So, that's a really good question. So some people have, when they get the COVID-19 vaccine, it's like maybe a flu shot, their arm gets a little sore, no other real symptoms. That doesn't mean that your immune system isn't reacting. Whereas some people, they feel their immune system reacting more and they get a fever, they get aches and pains. My nurses and a lot of younger adults I talked to said, I felt like I was really hungover the next day. I'm sure that none of you really know what that feeling is like, right? Since you're all CMC alumni. And so that is an immune system response, but it doesn't mean that your response is based on those symptoms that you have or didn't have. I actually really had no symptoms after either of my vaccines. I got the Pfizer vaccine and I actually got it early. I was one of the first healthcare providers to get the vaccine. It wasn't because I wanted to be first. I actually wanted to give it to the ER doctors and the ICU nurses and everybody else first. But what happened was my hospital had extra doses and they called everybody and said, please, please, please come over today. We have to get these doses in arms. We can't let them go to waste. And so I ran over and got it one of the first days, even though, I wanted to make sure everybody else that was more at risk got it before me. So I was fully vaccinated by, mid-January, which was actually very, very early. I didn't have any symptoms. I do know that I have an antibody response because I had to get blood work done for other reasons and I checked. And so it doesn't necessarily mean you do or do not have a response based on your symptoms. The majority of people will have a good and long-lasting antibody response after getting the vaccine. And that's something that they're studying right now. Let's not forget that last summer was when they started the first trials, right? Last summer, early fall. So the doctors that I know that were in the original Pfizer study, they've already gotten a booster dose. And they were split into 2 groups, the normal Pfizer booster and the Brazilian variant Pfizer booster. And so we're going to be seeing that data coming out really soon. So there are about 6 months or more of data ahead of most of you based on when you got that vaccine. And that's how we will know, do you need a booster? When is it? Does that booster need to be more effective against some of these variants that we're now seeing? In terms of the current variants that we're seeing right now in a lot of other places, and India's, having, as most of you know, a really rough time right now. They're really, like we were back at the worst of it. And it's so unfortunate and hard to see. And, I have many doctor friends that are going over there and trying to help. The good news is that it is turning around though. And so I think that's going to be a little bit of a silver lining, and vaccination rates are increasing. But right now, it looks like the current vaccine we have is neutralizing those antibodies of all the different variants. And I apologize because we're not supposed to say where the variants are from. We're supposed to say the numbers. But to me, that's a lot of numbers. And I know the numbers don't really mean anything to you. So whether it's the Brazilian or the UK or the Indian variant or any of those, right now we are seeing a pretty good level of neutralizing antibodies from the current vaccines we have here, in the United States. So I think that is great. I'm just scrolling back here. So yeah, let's talk about the differences between the different kinds of vaccines. So the Pfizer and the Mrna Vaccine are mRNA vaccines. So what that means is you are getting a little message injected into your arm that rapidly goes away and leaves your body, within a few days. And that teaches your body how to make a little spike protein that then it will make antibodies against. So none of these current vaccines that we have actually part of COVID-19 in them. They don't contain any live virus. They don't contain any killed or inactivated virus. They sort of work in a different way. With the mRNA vaccine, it does cause this inflammatory response in your body. So there are some rare cases of inflammation that we're seeing as little side effects. Now, it's all temporary, which is great, but some people are getting like lymph nodes under their arm. That might be why many of you, many of the women on the call might have been told, don't get your mammogram for another few months because it might show some inflammatory markers that would be a little confusing. Some people might have had a little, if they got blood work done, seen a little inflammation like in their liver or something like that. I actually had that, which rapidly went away. But that's one of the side effects of the mRNA vaccines. The Johnson & Johnson vaccine and the AstraZeneca vaccine are a little different. And they are both currently as I'm saying that now, I think they're doing 2-dose AstraZeneca. AstraZeneca is not yet approved in the United States, but it is what they're mainly giving in Europe. So the J&J vaccine is a little bit different. It's a viral vector vaccine. So it uses an adenovirus, which is a similar virus, but a different virus, to help your body make the antibodies. Similarly, it's all making antibodies to the spike protein, which is on the COVID-19 virus. So the end result is really all the same. Now, the reason the J&J vaccine was put on pause for a little while in this country was because there was an increase seen in these very serious blood clots from people who have gotten the J&J vaccine. Now, initially, it did seem very alarming, and actually any serious side effect is alarming. But when the data was really evaluated, it was not at an increased rate to the normal risk of serious blood clots in the United States. It was about 1 in 1 million. And if you compare that to, let's say, being on birth control pills, where we know it's like 1 in 10,000 risk of getting a blood clot, or if you actually get COVID-19, it was, oh my gosh, I don't even remember the numbers right now. When I did the news segments on J&J like a month ago, I knew them all, but it was even much higher than that. It was like, instead of 1 in 10,000, it was like 14 in 10,000 if you actually get COVID-19. So from the vaccine is still a dramatically lower amount than actually from getting the virus. If you get the vaccine, you have a much lower rate of getting a blood clot than if you actually get infected. That said, I think for women in that age group, 18 to 40, where we know that you are more prone to blood clots anyway because of hormones in your body, the recommendation is, if you can, to get one of the other vaccines, the mRNA vaccine. So I've been saving the J&J vaccine for like all the dads that only want one shot, and for anyone over 40 that really only wants one shot, the one and done. And in that case, it is very good. Originally, I thought it was going to be the perfect vaccine for those college students. But again, I think for the female college students, I would rather have them get the mRNA vaccine just in case. But again, always ask your own doctor before, if you make any of these decisions, because I'm not giving direct healthcare today, and I'm really just a pediatrician. And many of you are older than the age group that I usually treat, in my office. There is also a new vaccine that's going to be coming out soon, Novobax, which is a more traditional vaccine. And that is going to be another opportunity for those who maybe don't want an mRNA or don't want the Johnson & Johnson vaccine to get in the United States. And when it comes out, I believe it is going to be approved down to age 12, with the data. Currently, Pfizer is the only vaccine that we have authorized for 12 and up. But the Mrna data is being evaluated by the FDA right now. I think in the next month, we're going to see Mrna available also for 12 and up, which is going to be great because it's going to allow more access. I don't know how many of you, are really familiar with giving the vaccines and storage of the vaccines, but many people have been saying, why doesn't my doctor have the vaccine in their office? Why can't I take my teenagers and young adults to their pediatrician to get the vaccine? And in some cases you can, but the Pfizer vaccine, there's been a little bit of logistical challenges giving it as a primary care physician. And the reason is that Pfizer ships it in lots of approximately 1,100 doses. It comes in like a pizza box on dry ice. And it has a very short lifespan. So you can keep it on dry ice for a while, but once you move it into your regular freezer, in the past it was only good for 2 weeks. They just increased that to a month. And once you move it into your fridge, it was only good for 5 days. They also increased that longer. And once you pop open that vial, you have to give all 6 doses within 6 hours or you waste them. And I don't like wasting any vaccines. So that's been one of the hardest things about running all these vaccine drives is I group the patients or the students in groups of 6, because I don't want to have even 1 or 2 doses left over at the end, because if no one takes them and the 6 hours goes by, we have to throw them out. And so that's why it's not like a normal whooping cough vaccine where you can just make an appointment at your doctor's office and say, oh, hey, can I get the COVID vaccine today? They have to plan for it, and they have to group patients in certain groups by groups of 6 and have a vial that's ready to be open. Mrna is not as tricky as Pfizer. And so once Mrna is authorized down to age 12, that will be something that more doctors can have in their office and give out a lot easier. But that's sort of been one of the logistical challenges of the Pfizer vaccine and to why you have to go to one of these sites to get the vaccine or to a pharmacy. Let's see what other questions here people are asking. What is it about the Pfizer vaccine that makes it suitable for kids? It's really just that they have the data. They were sort of the first one to start working on the clinical trials in the younger kids and to have enough data to be able to present it to the FDA. Johnson & Johnson and Mrna have also been testing it down to 6 months of age for a while, but their data wasn't fully ready yet. And I don't know why. It depends on the different locations and the age groups that you're in and how long you're following them for. Clinical trials are done a little bit differently in kids, especially now, because with adults, when you give a vaccine, you're looking for safety profile, right? You're looking to see, is it safe? Are there any side effects? You're looking to see the antibody response, and then you're looking to see the efficacy, like when they go out into the world, how many of them get COVID? Well, right now there's not that much COVID. And when you're doing a trial with young kids, you're not sending them out in the world to get COVID, right? So we're really just looking at, is it safe? What's the antibody response? And what's the dose gonna be? We don't know the dose yet for the younger kids. For 12 and up, it's the same dose. It's the same 2 doses for Pfizer, 3 weeks apart. So my 12-year-old, well, he's actually 13 now. My 13-year-old son got the same dose that I got and my husband got. My 6-year-old, I don't know that that's gonna be what it is. It might be half of a dose, and we don't know yet. It's really interesting. If you look at all the vaccines we give in this country, there are certain vaccines like the flu shot, where it's the exact same dose for 6 months and older, all the way up through adults, not necessarily for elderly. Sometimes they get a higher dose. Whereas certain shots like whooping cough, the little kids get a higher dose than adults. And there's certain shots like Hep A and Hep B where the little kids get a lower dose than adults. And it has to do with the immune response that they make. And sometimes it varies. And that's why we really need the clinical studies to show this to us. Some people are asking about vaccine hesitancy. And it's funny, I wasn't actually thinking we were going to talk about vaccines the whole time, but that's just sort of where this went, because I think, that this is really the most important thing going on right now in our country. And this is how we are going to get back to normal. When you look at COVID-19 rates right now in almost any state in our country, it's directly related to the vaccine rate. The higher vaccine rate, the lower COVID-19 rate. And that's what we're seeing. And that's what we're going to continuously to see. And it's really a race against the vaccine, because getting the vaccine not only protects you, but it decreases the chance that we will have more variants. And that's the second very important reason why we need to vaccinate everybody. Because the more that this virus keeps spreading through our population, even through the little kids, it can change, it can mutate. And that's what we worry about, is if we keep letting it mutate, eventually we're gonna have a strain that can evade our current vaccine. So that's why we really want everyone to get vaccinated, to protect themselves, but also to really stop this pandemic in its tracks. And I think if we continue at the rate that we're going, we are gonna see things returning to normal, fairly quickly. And right now, it kind of depends where you live in this country, right? Many of you are aware of all the recent new CDC guidelines that if you're fully vaccinated, first it was you don't have to wear masks outdoors, then it was you don't have to wear masks indoors. But the CDC just makes guidelines. It's up to every state and local public health district, like in LA, it's LA County, to really decide when it's the time to lift the mask guidance in their own area. And unfortunately, as we've seen across the country, a lot of it has gotten very political, right? And as I've always said, why is public health political? But you know what it is, and we're not really going into that today, since I'm not really a political person. I'm a public health person, and I'm all about the science and about our kids. But that's sort of what we're seeing right now, and it's really interesting because 20 minutes from where I live, there was a fight in Costco because there were some actors that were refusing to wear masks, whereas in California, you still have to wear masks inside. But then at my local Trader Joe's, my nurses walked in yesterday during lunch and were told, hey, you nurses, you must be vaccinated, take your masks off. So you really have to go with what the local guidance is where you are. And right now in LA and California, it's still to wear masks indoors. I anticipate it's going to change soon. I know right now, June 15th is the date. There's a lot of talk right now with California Public Health and local Los Angeles Public Health. It may change sooner, but again, what's the rush? We're almost there. And I think waiting until the end of the school year is probably a really good idea, because it's sort of still the safest right now for all of our little kids and even our middle and high schoolers while they are still getting fully vaccinated. And I want to incentivize that age group to get vaccinated, but I also don't want to have like a have and have not right now on, at high school, when some people don't have to wear a mask and others are still a week away and still have to wear their mask. I think it's better to just incentivize for next fall and keep everything the same right now. So I didn't answer your question about vaccine hesitancy though. So what do you do for your friends, relatives, colleagues who might be vaccine hesitant? And I know it's really a hard conversation. It's something, we've been dealing with in this country for a really long time when it comes to vaccines, especially in California, we have the vaccine law, which I like because it sort of takes that conversation out of my hands when it comes to kids going to school, because they have to get fully vaccinated to go to school here, but it does differ around, across the country. I think, for most people, I think having them really go and talk to their own physician is really the best thing to do. And I find that when I really sit down with my families and I talk to them and I listen to their concerns and I address each one and I explain how the vaccine works and what the myths are out there and how it's impossible that it can affect future fertility, or any of these rumors that kind of got started on the internet that just aren't scientifically plausible, and the benefits of getting vaccinated, so that way you can return to normal life, and your teenagers who really have missed out on so much over the last year can go to summer camp and be fully vaccinated and be able to go without a mask. And how if we get to 90% level at our local schools, I'm going to recommend that they don't need masks indoors, in the fall. That's sort of the number I'd like to see in the classroom, is 90%. It might be less in some areas with low community spread, but I think 90%, and you'll be great, because there are going to be some who can't get vaccinated, for medical reasons. It's not very common, but there are going to be a few. And we do want to protect, those patients who are on chemotherapy, or for other reasons, their doctors asking them to, wait a little bit longer. The other thing is that know that, if you have a neighbor or a family member who just doesn't want to get the vaccine, by vaccinating yourself, you are very well protected. So, sometimes I think in families, it's better to not, fight that battle. Family dynamics are very complicated, as it is. And so sometimes all you can do is sort of protect yourself and your own kids, and and kind of just end it there. And I'm saying this because I was talking to a few of you earlier about a conversation, and I think, you're not always going to win that battle. So leave it for a doctor or somebody else to fight. Let's see, what other questions here? What are the long-lasting effects of COVID-19? That's a great question. COVID-19 is a very weird, unusual virus. And while it can be mild in so many people, it's still really scary. We are only beginning to understand the long-term consequences of getting COVID-19. And there was some data actually released this morning about, even with kids, we are seeing a lot of long haulers, or later complications of having COVID-19. So in kids, we're seeing an increase in type 1 diabetes and other autoimmune issues. We're seeing more anxiety, mental health issues, fatigue, all the stuff that you're actually seeing in adults as well. And I didn't even mention like the MIS-C, which is the really serious inflammatory condition that can happen after kids are exposed, where they really need to go to the hospital and get treatment. I was just talking to some local psychologists here in LA who work with the firefighters, and a majority of our firefighters did suffer from COVID-19 at the beginning. They are having increasing, record amounts, which is so sad, of mental health issues, neurological issues stemming from having COVID-19 last year. And so this is something that we're really, working on, and there's centers around the country that are studying this and looking at treating it. So I think it's not just a benign cold, as many people, feel that it is. I think we are going to learn about long-term consequences and issues that we're seeing, even over the next few years. There's so much that we're going to be finding out that we still don't understand. And that's why I've been very careful to protect my own kids. I've been worried about them getting COVID-19 because there is so much that we don't know. And I think there will be a lot of things that we're going to be learning about and seeing, in the future. That said, in general, I do want to acknowledge that kids were not hit quite as hard as adults, and they did not, end up as sick and in the hospital, as much. We had millions of kids affected in the United States, thousands of hospitalizations, and a little over 300 deaths, which, although very tragic, is not near the number of, adult fatalities that we had. But it's still something, one of these viruses that is going to stick in your body and, cause problems later on, which isn't a new thing. There's other viruses that we've known to do that. Measles has always lived, in people, in their brain, and come out and reactivated them. Chickenpox stays in your nerve cells and causes shingles later on. Mono, we know the long-term effects of mono and Epstein-Barr virus. So it isn't a new idea that some viruses can just stay in your system and cause issues. Evan asked it about a new flu shot. Oh, is this a new flu shot? So right now, the technology of the way the current flu vaccine is made and the COVID-19 vaccine is made is different. I'm not aware of anyone working on a combination right now, although I could, talk to the scientists that I know, the vaccine scientists, and ask them. But right now, I think everyone's still working separately on the COVID-19 vaccine and making sure that it works against the current variants. Something that is new is that, initially with the COVID-19 vaccine, they said it's best to separate it by 2 weeks from other vaccines. And we have so much more data now that that recommendation was changed last week. And now the recommendation is that COVID-19 can be co-administered at the same time as other vaccines. So I think what we're going to be seeing this winter is that you can go to your doctor's office or a local pharmacy and get the COVID-19 vaccine at the same time as the flu vaccine, or a booster for COVID-19 at the same time as the flu vaccine. I don't think they are going to be combined into the same vaccine for a while, because they are very different. And even though the flu is a virus that does change every year, it's a different type of mutation every year. What are some ways to help prepare students for going back to campus? Okay. I think that this has been a really hard year, longer than a year, for so many of us around the country, no matter what the age is, right? I mean, we all were home for a while. We all were worried for a while about ourselves, about family, about friends. Some people, couldn't go to work. That might have affected them from an economic standpoint. We've all lost loved ones and known people that have really, suffered from COVID-19 and even passed away. And so I think all ages, we're going to see this re-entry sort of phenomenon as people get back to normal. And in some ways, we're seeing it differently in every different age group. We're seeing it differently in vaccinated individuals versus not vaccinated individuals. Not necessarily in the way you would think. There was a recent article in Forbes about a study, it came out yesterday, about a study that showed that vaccinated people are actually more worried about shedding their mask and going into the grocery store than those who are unvaccinated, right? And that might be due to their original beliefs, on COVID, and if it, is real or not, because we know that some people still don't think COVID exists, which when I was working with schools in Texas, that was a big issue. That was a really big issue. And we kind of had to tackle that in a different way. So I think the most important thing is to sort of, talk to anyone, no matter what age group, and specifically for the college students. I think having a conversation, how are you feeling about this? Some of you might have been home in your bedroom, with your parents for the last year, not seeing anyone. Others might have been living alone. Others might have been living with a few other college students and they had a little more social interaction. But for so many of our young adults and teenagers, they really have had minimal social interactions over the last year. And that's going to be an issue. It's going to take them a little while to get back to feeling comfortable, talking to other people and socializing with others and just being, in person. We know that so many of our college students are, better anyways at texting their friends than talking one-on-one. And in some ways that was good for COVID, but also it's not the real world. And, they do need to learn how to get back there in person. So I think making sure that you have mental health services available, that the RAs are always in touch, just having group conversations, recognizing any students that seem to be sort of withdrawn or not necessarily getting out and about, or anyone that seems anxious or is having issues. CMC has always been so good at that. I mean, even before COVID, that's something that you did, that you were so good at, and making sure that everybody was included and everybody was feeling comfortable. And so I think, getting back to school this August, that's just going to be something that you're going to have to be a little more aware of, but I have no doubt that you're going to, handle it really well. Texas, somebody was asking about Texas. So it was early on in the pandemic that I was working with schools in Texas. And part of what I was doing at the beginning of the pandemic was educating families. And so when it came to some of those schools where they said, Tanya, there is no amount of education that we can give our families that are going to do anything to sort of protect their own kids in our school because they don't feel this exists. Our teachers are scared. What can we do? And once I realized that there really wasn't a good way to communicate to these parents, I sort of went into the let's protect the teachers mode, which now that they're vaccinated is not as much of a thing. But back then it was like, okay, we're going to make sure the teachers are wearing N95s and face shields, are 6 feet from the students, because the teachers had to go back to school right away and they were terrified. So that was sort of the angle that we took there. And again, that's all sort of a, not as much of an issue now because the majority of the teachers are vaccinated, and feel more comfortable now. But that was sort of the way I handled it. Like, okay, let's work on protecting the teachers and let's back off on educating the parents, since they were getting so defensive and didn't really want to hear what we had to say. Okay, what else do you guys want to talk about? Booster shots. I don't know yet. I've been a little bit more into the data on the younger kids with their first vaccine than I have been under the booster data for adults. I think we will know this summer. We'll have, some guidance on what is sort of coming. There's a few different ways that they could sort of go about this. One is they could say everybody needs a booster. They could say, you know what, go ahead and check your antibody titers and see if you need a booster. Or it could be, you know what, the new booster is different from the original vaccine to protect against these variants. We want everybody to go ahead and get the booster anyway. And so, it's going to be interesting. I mean, there's some adults who were so knocked out by that second Moderna or Pfizer vaccine that it's going to be so hard to convince them to get a booster dose when they feel fine and maybe they're still protected because they checked their antibodies. And so this is something that I think we are going to need specific guidelines for as we go into the winter next year. I think that although COVID is decreasing at a very rapid rate right now, which is amazing, especially in Los Angeles, we are starting to see an increase in other non-COVID illnesses right now in the community and in all the schools that are still in session, because people are out and about and kids are all in the same room, touching the same things. And so in my office, I have what's called a PCR respiratory panel, big lab device, so I can swab someone's nose in an hour, know, do they have COVID? Do they have rhinovirus, which is a common cold virus? Do they have human metapneumovirus? Do they have the flu? Do they have mycoplasma? And I think those diagnostic tests are going to become even more important as we're trying to figure out what is this cold that you have, and can you return to the workplace or can you return to school if it's not COVID? Because it's going to be, whenever you see somebody and they're coughing or sneezing, you're going to be worried, right? Like, do they have COVID? What do they have? And so I think just knowing is it COVID or not COVID may not even be enough to get people back to work, that still have the sniffles. We're going to need to tell them what it is and, what the risk is for transferring it to other people, or what the risk is for, if they were to get someone else in their community sick with it. So I see that is becoming more important this fall and winter, because we are going to see more cases. This winter, we're still going to have COVID. I think that, my prediction is that we'll still have it, but most of us will be vaccinated. So it won't be as scary. It won't be as big of an issue. When people get it, they'll still have to quarantine, but we probably won't necessarily have to quarantine everybody around them as much, because we'll be able to do things like test to stay, where we take everybody around them in the class at school and say, you know what, you guys are asymptomatic right now. We're just going to test you every other day. And as long as you don't have it, you can stay in school. You don't have to go sit home and do remote school, because my goal is to keep kids of all ages and college students as well in the classroom learning, as much as possible. I mean, we know there are so many benefits from in-person learning, and maybe for college students, they might not matter as much if they can be on their laptop in their dorm room, but still, they're more interactive, engaged, and learn better when they are in person in class. And I don't think anyone would argue for that. I got a few private messages to me asking about the United States versus worldwide. And I do know that we are starting to ship millions of doses of vaccines worldwide, because we have so many here to really help decrease the spread worldwide. Because we know that if we If we only protect our country and we let it spread in other countries, they are just going to have more and more variants that will eventually come back into our country and evade our vaccines. And we'll be back, almost to square one where we were last year. So I think it is important now that we have such a good control in our country that we really take our resources and our efforts outside of our country and try to help everybody, because this is a worldwide pandemic, and we saw how quickly it spread initially, and we really don't want that to happen again. And I know Europe just reopened up for vaccinated people. Now they can travel, and so I think that's really amazing, and we're going to be seeing more and more of these guidelines changing if you're vaccinated versus if you're not vaccinated. So I think that's going to also be really important in, decreasing the spread of COVID-19 everywhere. I know we're kind of winding down, so are there any other questions going on that you want me to talk about?
Tanya, I put one in at the very bottom just recently that I think some of the hesitancy I've heard from some people is how quickly the vaccine was made. And so any comment on that, but then also does that mean we could expect more vaccines coming online because of the technology and the speed for other viruses?
Yeah, so there's actually been some great documentaries recently on the mRNA vaccine and actually how long we've had this technology around. And it's been used, it's even older than the 10 years that we've been using it to make vaccines and potentially treat cancers and other things caused by viruses. So the technology has been there, and that's why they were able to sort of put it into play quickly. The other thing that they did differently with this vaccine is they actually poured so much money into production. So before they knew which vaccines were going to be safe and effective, they wanted to make sure we had hundreds of thousands of doses ready to come off the conveyor belt and be able to give, even though they knew that not all of those were going to be approved. So they were working in parallel, a lot of different processes that normally you'd wait for one process to end and then go to the next one, because we knew that this was really needed and going to be the best way out of the pandemic. This vaccine, in the United States now, we have given hundreds of millions of doses, billions of doses worldwide. There really are very few serious side effects. So I do feel this vaccine is safe. And I actually feel so comfortable with this vaccine now. And if you had asked me, 3 months ago, was I ready to give it to my 6-year-old? I would have said, not yet, I want more data. I honestly am ready now to give this to the young kids. I feel like it is that safe. And I've even been debating, should I give my 6-year-old a half a dose? I wouldn't yet, I want a little more data, but I feel like we are ready, that all kids should be vaccinated by the fall for the school year. I expect to see the data and authorization on that end of summer, beginning of fall, but I think we're there, and I do think it's very safe. And if for those of you that have been waiting, I'd say, what are you waiting for now? We have so much data on the safety and the efficacy that I think it's there. I think it's fine. And I think when you look at the risk benefit, the serious risk of getting COVID-19 and everything that we know that COVID-19 can do to your health and your body, not only to your lungs, to your entire immune system, to your brain, all the problems that it caused, all the strokes, all the clots, and you compare that to the minimal side effects from the vaccine, I think it is far safer to get the vaccine no matter what age you are. Someone's asking me about hair falling out side effect of getting COVID. Okay, so hair falling out is actually a side effect of getting any illness, even being pregnant. We often see this about 3 months later, and it has to do with the cycle of your hair follicles. So yes, when my patients and parents get any serious illness or disease, 3 months later, that is something that we do see, and almost any doctor will tell you that. So it's not specific to COVID-19, but for sure you're going to see that. Not with the vaccines, with the actual illness and disease.
There's a question in there about the Olympics. What can we learn from Japan in the Olympics, and what should we expect to hear that is misleading in regards to vaccines and COVID?
No, it's a good question. I don't know that I'm really up on the latest of the Olympic guidelines right now. I could have found out though, if I had known that you wanted to talk about that. I mean, I think right now they're holding them with limited audience, right? Which I think still makes sense with the, the COVID issues that we have going on, worldwide. I like what the Dodgers and other stadiums are doing with the vaccinated sections and the unvaccinated sections. I mean, I think when people are vaccinated, then yes, it's okay to travel. It's okay to sit close to each other. When you're unvaccinated, I'm still worried. I mean, until we really have herd immunity, I think you should be distanced from others. I think you should be wearing masks. And I think there should be fewer people, in attendance that aren't vaccinated and protected.
Great. And then Allison just kind of put in there, what else should we be asking? What else should we know? What have we not talked about yet? Anything that we've missed?
Let's see. Well, this is actually my third talk of the day. So now I'm trying to remember what we talked about and what I talked about this morning. But I think, we know so much more now than we knew a year ago. That said, we're still learning new things every day, and guidelines are still changing every day. And I know many people are just, so ready for this to be over. And I would say we are almost there. We are so close, but don't rush it, because we still have a portion of our population that can't be vaccinated yet, or that is still waiting, is still looking at the data, is trying to decide, are they ready? And so we're getting really close. There is a light at the end of the tunnel. I do anticipate by, midsummer, things to be almost back to normal. But I would say, why rush? We've held out for this long. I think in some ways a few more weeks, which many areas around this country, the states are asking you to wait a few more weeks. And I think, I think it's fine. Why rush this? We will get there. And if you're vaccinated, you're going to be able to get there sooner and do more things sooner, like travel and not quarantine. If you get exposed, not quarantine, and all those things that make so much sense based on the data that we currently have available.
Well, thank you, Dr. Altmann. I had one message come in just to me. It says, just to confirm, Tanya said that we no longer wait the 2 weeks after the second vaccine to get other vaccines. I think that is true.
Exactly. The latest guidance from the CDC, the FDA, and the ACIP is that you can give the vaccines at the same time or even like a few days apart. So yes. So that is totally fine. Again, talk to your own physician, because there may be some reasons why you do want to wait. I mean, if I have a teenager come in that needs several vaccines, I might talk to the parents and say, okay, let's give 1 or 2 now. Let's give 1 or 2 in a month. But yes, there is no waiting time that's recommended anymore.
And that was the follow-up, was even for an 18-year-old who needs multiple vaccines. So thank you for answering that.
Yeah, you can get meningitis and COVID and HPV all at the same time if you need to. That said, I would take it easy for a day or two and drink a lot of fluids, because you might be a little wiped out while your body's making antibodies to all of these different things, but there's no contraindication to doing that.
Great. And one last question before we wrap up. When do you think the vaccines will be fully approved out of the emergency stages?
Next month. I think over the next month or two, the FDA is going to have fully approved the vaccines. And it's interesting. That was one of the debates about a month ago. Many of us, including myself, were really pushing to get the authorization down to 12 years of age. And the FDA was meeting and they were trying to decide what is better, to get it down to 12 first or to fully approve it. And there were good arguments on both sides. And I don't know why it couldn't be done at the same time. But I was arguing we want these younger kids vaccinated before summer camp. If so, we cannot wait even another 3 weeks, or they won't make it to be fully vaccinated before summer camp. And so that was the data they looked at and evaluated first. And now they're looking at the full FDA approval. And I do think that's going to come out, in the next month.
Great. Dr. Tanya, thank you so much. I put your web address in the chat. If anybody wants to go and learn more about Dr. Tanya, you can also see her published works. I know you are a prolific author, especially when it comes to pediatrics and raising children. So thank you for all you do for CMC and for our global community. And everyone, feel free to unmute, say hello, say goodbye, and say thank you. All right. Have a great day, everybody.